In this session, we will be discussing about the origin, insertion, nerve supply and action of the different muscles of the body. So, we will start with the muscles of the head and neck first. So, first of all, the muscles of the head. There are lots of muscles are seen, especially 6 muscles are seen at the head. The muscles are occipitofrontalis, then orbicularis oculi, corrugator supercilii and depressor supercilii. So, the muscles include occipitofrontalis, frontalis, orbicularis oculi, corrugator supercilii and depressor supercilii. Occipitofrontalis, it contains 2 occipital bellies and 2 frontal bellies, and it is inserted at the gallia aponeurotica, and nerve supply is from the facial nerve, and action of this occipitofrontalis is raises the eyebrow. This is the muscle which causes raising of the eyebrow. Then next muscle is the occipitalis. Occipitalis originates from the superior nuchal line of the occipital bone and the mastoid process of the temporal bone. Now, it is inserted at gallia aponeurotica, and the nerve supply is again the facial nerve, especially a branch called posterior auricular nerve, and its action is wrinkling of the eyebrow. Frontalis originates from the gallia aponeurotica, and it is inserted at the mastoid process, and nerve supply is from the facial nerve. Its action is wrinkling of the eyebrow. Orbicularis oculi, next muscle is the orbicularis oculi. It is originate from the frontal bone, medial palpebral ligament and lacrimal bone, and it is inserted at the lateral palpebral raphe, and its nerve supply is zygomatic branch of the facial nerve and the temporal branch of the facial nerve, and its main action is closes, it is the muscle which closes the eyelid. Next muscle is the corrugator supercilii. It's originate from the superciliary arches, and is inserted at the forehead skin near the eyebrow. Nerve supply again the facial nerve, and it is the muscle which wrinkles the forehead. And depressor supercilii, its origin from the medial orbital rim, and it is inserted at the medial aspect of the bony orbit. Nerve supply is the facial nerve, and its main function is depression of the eyebrow. Now, the muscles of face, these are the muscles of facial expression. Occipitofrontalis we already discussed. Then procerus, nasalis muscle, depressor septi nasae, orbicularis oculi, corrugator supercilii, depressor supercilii, auricular muscles, orbicularis oris, depressor angulae oris, risorius, zygomaticus major, zygomaticus minor, levator labiae superioris, levator labiae inferioris, and levator labiae superioris, levator labiae superioris, then depressor labiae inferioris, levator angulae oris, buccinator, mendalis and platysma. These are the muscles seen at the face. Now, we will go through some important muscles. Orbicularis oculi, its origin from the frontal and maxillary bone, and it is inserted at the skin of the eyelid, and its action is blinking, squinting, forceful closing of the eyelids. Then orbicularis oris, its origin from the fibers of the mouth muscles, and it is inserted at the muscles and skin angles of the mouth, and action is closes and protrudes the lips. Then platysma, it is originate from the pectoralis and deltoid fascia, and is inserted at the lower border of the mandible and the mouth skin. Then its main work is depress the mandible, it draw angle of the mouth downwards, and it tightens the skin of the neck. This is the action of platysma. Now, extraocular muscles. Extraocular muscles, these include superior tarsus, levator palpebrae superioris, superior rectus, inferior rectus, medial rectus, lateral rectus, that is rectus group, then oblique group, which includes superior oblique and inferior oblique. So, the superior tarsal, its origin from the underside of the levator palpebrae superioris. It inserted at the superior tarsal plate, and it is the nerve supply is the sympathetic nervous system, and action it raises the upper eyelid. Levator palpebrae superioris, it originates from the sphenoid bone, and it is inserted at the tarsal plate of an upper eyelid, and the nerve supply is from the oculomotor nerve. Its main function is retraction and elevation of the eyelid. Then the rectus muscle group, there are 4 rectus are there. There are superior rectus, inferior rectus, medial rectus, and lateral rectus. Superior rectus originate from the annulus of the zin at the orbital apex, and it is inserted at the superior, it is superior to the corneal limbus, and its nerve supply is oculomotor nerve, and its action is elevation, adduction, and rotation of the eye. Inferior rectus, it is again originated from the annulus zin and the orbital apex, and it's inserted at the inferior to the corneal limbus, and inferior, it is supplied by the inferior branch of the oculomotor nerve, and its action is depression and adduction of the eyes. Then the medial rectus, it originates from the annals of the zin, and it is inserted at the again the corneal medial to the corneal limbus, and the nerve supply is inferior division of the oculomotor nerve, and its action is adduction of the eyeball. The lateral rectus, it is originate from the annulus of the zin, and it is inserted at the temporal to the corneal limbus, and its nerve supply is abducent nerve, and its action is adduction of the eyeball. Its action is abduction of the eyeball, that is lateral rectus, abduction of the eyeball, medial rectus, adduction of the eyeball, and inferior rectus, depression and adduction of the eyeball, superior rectus, elevation, adduction and rotation of the eyeball. There are oblique muscle groups of the eye. These are superior oblique and inferior oblique, and the origin of the superior oblique from annals of the zin, and inserted at the outer posterior quadrant of the eyeball. Nerve supply is trochlear nerve, and primary action is intrusion, and secondary action is its adduction and depression of the eyeball. So, superior rectus, superior oblique, it's starting from the annals of the zin, and it's inserted at the outer posterior quadrant of the eyeball, and the nerve supply is the trochlear nerve. Its primary function is induction, and secondary function is abduction. Inferior rectus, inferior oblique, its origin from the orbital surface of the maxilla lateral to the lacrimal groove, and it laterally it is inserted laterally to the eyeball, deep to the lateral rectus by a short flat tendon, and nerve supply is oculomotor nerve, and action is again extorsion, elevation and abduction. Now, the muscles of mastication. There are 4 muscles are there as considered as muscles of mastication. These are masseter, temporalis, medial pterygoid, lateral pterygoid. Then muscles of the craniocervical and upper thoracic region. Now, the functions of these muscles include it to hold the head upright against gravity, position the head in space in order to optimally position the sensory organs, movements of the vertebral column and movements of the scapula. These are the functions of the muscles of the craniocervical and upper thoracic region. So, it can be the in the posterior region. Once we see the posterior region, the muscles of the craniocervicothoracic region is seen as layers. The layers include there will be a superficial layer which include the trapezius and levator scapula. There is a splenius group including splenius capitis and splenius cervicis. There is a semispinalis group which include the semispinalis capitis and semispinalis cervicis, and there is a suboccipital group of muscles. So, in the posterior region, the most superficial muscles are the trapezius and levator scapula. It is the superficial muscles of the neck and upper thoracic region. Then there comes the splenius capitis, splenius group of muscles, that is splenius, it includes the splenius capitis and splenius cervicis. It is seen deep to the levator scapula and it produces extension when working bilaterally, and it produces when working unilaterally, it produces this muscle splenius group produces ipsilateral rotation. So, once it works once this splenius group work bilaterally, it produces extension, and once the splenius group work ipsilaterally, it produces rotation movement. Though just below the splenius group, there is a muscle group called semispinalis group. It includes the semispinalis capitis and semispinalis cervicis. It is seen deep to the splenius group, and it produces extension of the head and neck. Then below the semispinalis group, there is longissimus group is there. It includes longissimus capitis and longissimus cervicis. And the deepest muscle group is there. These are called suboccipital muscles. These are seen at the suboccipital region. It includes again 4 muscles. These are rectus capitis posterior major, rectus capitis posterior minor, superior oblique and inferior oblique. This independent movement over the craniovertebral region, its main movement is it produces an independent movement of the craniovertebral region over the lower cervical spine. So, suboccipital muscle group, these are the deepest muscle group, and its main action is it produces an independent craniovertebral movement, at the craniovertebral region over the lower cervical spine. The 4 muscles are there in the suboccipital group. So, once you see the lateral muscles of the neck region, these are known as scalenes. There are 3 scalenes are there seen. They are anterior, posterior and middle scalenes are there. Anterior scalenes, its main work is flexion of the cervical spine. Middle scalene, these are the frontal plane stabilizers. And the posterior scalenes, this main work is the lateral flexion. So, the lateral muscles are called scalenes, and there are 3 scalenes are there. These are anterior, posterior and middle scalenes. Anterior scalene, flexion of the cervical spine. Middle scalene, it is a stabilizer, frontal plane stabilizer, and posterior scalene is the lateral flexor. Now, next muscle seen on the lateral side of the neck is the sternocleidomastoid muscle. It originates from the manubrium sterni and medial portion of the clavicle, and is inserted at the mastoid process of the temporal bone and superior nuclei. Nerve supply is, it's having motor and sensory supply, motor supply from the accessory nerve and sensory supply from the cervical plexus. Now, its action is, once it acts alone, it tilts the head to its own side and rotates it so the face is turned towards the opposite side. This is the action. Once acting alone, the head tilt to its own side and rotate it so that the face turns towards the opposite side. Now, once it acts together, it flexes the neck, raises the sternum and assists in forced inspiration. So, it flexes the neck, if it works together, it causes the flexion of the neck, it raises the sternum and it assists in forced inspiration. Now, there are some anterior muscles of the neck. These are longissimus capitis, longissimus colli, rectus capitis anterior and rectus capitis lateralis. Now, once we go through the muscles of the neck, the flexors are longissimus colli, longissimus capitis, infrahyoid. The extensors are the splenius capitis, semispinalis capitis, suboccipital and trapezius. The rotators are the splenius capitis, sternocleidomastoid, levator scapula and suboccipitalis. The lateral flexors are the scalenes. So, these are the muscles of the neck. Now, we will go through the muscles of the shoulder. Now, we will go through the muscles of the shoulder. There are a muscle group called rotator cuff muscles. These are the stabilizers of the shoulder which helps in elevation and rotation of the arm. So, there are 4 muscles are there in the rotator cuff muscle group. These are supraspinatus, infraspinatus, teres minor and subscapularis. All these muscle arises from the scapula and inserted to the head of the humerus. So, there are rotator cuff muscles are seen. There are 4 rotator cuff muscles are there. These are supraspinatus, infraspinatus, teres minor and subscapularis. All these muscles arises from the scapula and inserted into the head of the humerus. So, the muscles are and its main work is it stabilizes the shoulder and helps in elevation and rotation of the arm. So, first of all, there is supraspinatus muscles are there. It originates from the supraspinous fossa and it is inserted at the superior and middle facets of the greater tuberosity. Its action is stabilizes the head of the humerus in the glenohumeral joint and it abducts the arm. Nerve supply is the suprascapular nerve. Next muscle is the infraspinatus muscle. Infraspinatus muscle originates from the infraspinous fossa and is inserted at the middle facet of the greater tuberosity. Its action is it stabilizes the head of the humerus in the glenohumeral joint and it externally rotates the arm. It externally rotates the arm. Its nerve supply is suprascapular nerve. Next muscle is the teres minor muscle. Teres minor muscle originates from the lateral border of the scapula and it is inserted to the inferior facet of the greater tuberosity. Its action is it stabilizes the head of the humerus, again is stabilization of the head of the humerus in the glenohumeral joint, and its main action is, and its another action is it externally rotate the arm and nerve supply is from the axillary nerve. Next muscle in the rotator cuff is the subscapularis muscle. Subscapularis muscle originates from the subscapular fossa and is inserted to the lesser tuberosity. Its action is it stabilizes the head of the humerus in the glenohumeral joint and it internally rotates the humerus. Nerve supply is upper and lower subscapular nerve. So, these all muscles are the rotator cuff muscles. So, its main function is its stabilization of the shoulder and helps in elevation of the rotator helps in elevation and rotation of the arm. So, any instability, any compromise of this rotator cuff muscle, cut कर लो. Hello. So, rotator cuff muscles, there are 4 rotator cuff muscles are there. It includes the supraspinatus, infraspinatus, teres minor and subscapularis. So, the main function of this rotator cuff muscle is it stabilizes the shoulder and helps in elevation and rotation of the arm. So, it's this rotator cuff muscle, it is one of the main muscle which protect the, which keeps the keeps the humeral head in position while doing the different activities. So, any compromise in the rotator cuff muscles will cause us a syndrome called impingement syndrome. Now, next muscle is commonly seen at the shoulder region is the deltoid muscle. It is a multi-pinnate muscle and its origin is from the anterior border of the lateral 1/3 of the clavicle and lateral border of the acromion process, lower lip of the crest of the spine of the scapula, and it is inserted at the deltoid tuberosity of the humerus. Nerve supply is the axillary nerve. Action is, it's having 3 types of fibers: acromion fibers, anterior fibers and the posterior fibers. Acromion fibers are the powerful abductors of the shoulder. Anterior fibers are the flexors and medial rotators of the shoulder, and posterior fibers are the extensors and lateral rotators. So, deltoid muscle, it is seen on the at the shoulder on the lateral side of the shoulder, and its origin from the, it's having 3 origin: anterior border of the lateral 1/3 of the clavicle, lateral border of the acromion process, lower lip of the crest of the spine of the scapula, and it's inserted to the deltoid tuberosity. Its action is it's having 3 types of fibers. Acromion fibers are the powerful abductors, anterior fibers are the flexors and the medial rotators, the posterior fibers are the extensors and lateral rotators. Now, we will be discussing about the muscles of the pectoral region or chest region. The pectoral region muscles include pectoralis major, pectoralis minor, subclavius and serratus anterior. Pectoralis major, its origin is from the anterior surface of the medial half of the clavicle. Anterior surface of the medial half of the clavicle, half of the breadth of the anterior surface of the manubrium sternum up to the 6th costal cartilage, and manubrium and sternum up to the 6th costal cartilage, 2nd to 6th costal cartilage, aponeurosis of the external oblique muscle of the abdomen. So, its origin is from the anterior surface of the medial half of the clavicle, half of the breadth of the anterior surface of the manubrium and sternum up to 6th costal cartilage level, 2nd to 6th costal cartilage, and aponeurosis of the external oblique muscle of the abdomen. Now, it is inserted in the lateral lip of the bicipital groove of the humerus, and its nerve supply is from the medial, its nerve supply is medial and lateral pectoral nerve. Its main function is, it is adduction and medial rotation of the shoulder. Its clavicular part causes the flexion of the arm. An extension of the flexed arm against resistance is done by the sternocostal part of the muscle. So, its action of the pectoralis major is, these are the adductors and medial rotators of the shoulder, and the clavicular part of the muscle causes the flexion of the arm, and extension of the flexed arm against resistance is done by sternocostal part of the muscle. Next muscle in the pectoral region is the pectoralis minor muscle. Pectoralis minor muscle originates from the 3rd, 4th and 5th rib near the costochondral junction, and it is also originated from the intervening fascia covering the external intercostal muscles, and it is inserted at the medial border and the upper surface of the coracoid process. Its nerve supply is from the medial and lateral pectoral nerve. Its action of the pectoralis minor is, it draws the scapula forward and depresses the point of the shoulder and it helps in forced inspiration. So, pectoralis minor muscle, it helps in forced inspiration also. Next muscle in the pectoral region is the subclavius muscle. Its origin is from the first rib at the costochondral junction, and it is inserted at the subclavian groove in the middle 1/3 of the clavicle. Now, its nerve supply is from the nerves to subclavius. Nerve supply is nerve to subclavius, which is from the brachial plexus. Its action is it steadies the clavicle during the movement of the shoulder. So, subclavius muscle steadies the clavicle during the movement of the shoulder. Next muscle at the chest region or pectoral region is the serratus anterior muscle. This is also called boxer's muscle. So, serratus anterior is occasionally called big swing muscle or boxer's muscle, because it is largely responsible for the protraction of the scapula, that is, pulling the scapula forward around the rib cage that occurs when someone throws a punch. So, origin of the serratus anterior from fleshy slips from the outer surface of the upper 8 or 9 ribs, and is inserted to the costal aspect of the medial margin of the scapula. Nerve supply is long thoracic nerve. It is from the root of the brachial plexus C5, C6 and C7. Action is protraction and stabilization of the scapula, and it assists in upward rotation of the scapula. So, these are the muscles of the chest region or muscles of the pectoral region. It includes the pectoralis major, pectoralis minor, subclavius and serratus anterior. Now, we will be discussing about the muscles of the arm. Muscles of the arm, the muscles can be divided into two compartments. There is an anterior compartment and there is a posterior compartment, and the muscles of the anterior compartment include the coracobrachialis, biceps brachii and brachialis. Muscle of the posterior compartment is the triceps muscle. We will be discussing about the muscles of the anterior compartment first. The first muscle is the coracobrachialis muscle. It arises from the apex of the coracoid process in common with the short head of the biceps brachii and from the intermuscular septum between the two muscles. And it is inserted by means of a flat tendon into an impression at the middle of the medial surface and borders of the body of the humerus or shaft of the humerus between origin of the triceps brachii and brachialis. So, it is inserted like a flat tendon into the impressions of the middle of the medial surface of the body of the humerus or shaft of the humerus and between origin of the triceps brachii and brachialis. And its innervation is from the nerve supply is from musculocutaneous nerve, which arises from the anterior division of the upper and middle trunk of the brachial plexus. Its work is, its main action, the main action of the coracobrachialis is it adducts the humerus, flexion of the arm at the glenohumeral joint. Next muscle of the anterior compartment of the arm is the biceps brachii. It originates making a short head and a long head. Short head from the coracoid process of the scapula and long head from the supraglenoid tubercle, and is inserted to the radial tuberosity and the bicipital aponeurosis into the deep fascia on the medial part of the forearm. Action of the biceps brachii is it flexes the elbow and supinate the forearm. Nerve supply is from musculocutaneous nerve. The nerve root is C5 to C7. So, biceps brachii, this is another anterior muscles of the anterior compartment of the arm. Next muscle is the brachialis muscle. Brachialis muscle origin from the anterior surface of the humerus, particularly the distal half of the humerus. So, originate from the anterior surface of the humerus, particularly the distal half of the humerus. Insertion to the coronoid process and the tuberosity of the ulna. and its nerve supply is the musculocutaneous nerve, and the action of the brachialis is flexion of the elbow. Now, muscle of the posterior compartment is the triceps brachiae. Triceps brachiae, it's originate by making three heads, that is a long head, a lateral head, and a medial head. The long head from the infraglenoid tubercle of the scapula. The lateral head is from the posterior humerus, and the medial head is also from the posterior humerus, and it is inserted to the olecranon process of ulna. So, triceps brachiae is the posterior muscle, and it's make three head, its origin from the three head and inserted into the olecranon process of ulna. So, its main action is extension of the elbow. So, the arm muscles of the arm can be divided into two compartments, an anterior compartment which include the coracobrachialis, biceps brachiae and brachialis, and the posterior compartment muscle which is the triceps muscle. Now, we will go through the forearm muscles. Forearm muscles can be divided into two types of muscles, that is muscles seen at the anterior compartment and muscles seen at the posterior compartment. Muscles seen at the anterior compartment are mainly the flexors muscle, flexor group of muscles. So, anterior compartment muscles are the flexors of the wrist, and this can be again further divided into a superficial group of muscles and a deep group of muscles. The superficial group of muscles all have the same origin. The origin is the medial epicondyle of the humerus, and the deep muscles, there are 5 superficial muscles and 3 deep muscles are there at the anterior compartment of the forearm. Now, the superficial muscles include the pronator teres, flexor carpi radialis, flexor carpi the superficial muscles include the pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis, and all these muscles have a common origin. The origin is the medial epicondyle of the humerus. Now, the deep muscles, there are 3 deep muscles are there. These are flexor pollicis longus, flexor digitorum profundus, and pronator quadratus. Now, we will go through the origin and insertion and nerve supply of this superficial muscle. The first muscle is the pronator teres muscle. Pronator teres muscle is having 2 heads, a humeral head and an ulnar head. The origin is from both heads, that is humeral head and ulnar head. Humeral head, it is from the common flexor origin, that is from the medial epicondyle of the humerus. Ulnar head from the medial border of the coronoid process of the ulna, and it is inserted to the lateral aspect of the shaft of the radius, and its nerve supply is from the median nerve, that is the C6 and C7 branch of the brachial plexus, that is C6 and C7. Its action is 2 action. Its pronator teres is having 2 action, that is pronation of the forearm and flexion of the elbow. The next superficial muscle of the anterior compartment of the forearm is flexor carpi radialis. Flexor carpi radialis originate from the medial epicondyle of the humerus. Again, that is the common flexor origin and is inserted to the base of the 2nd and 3rd metacarpal bone. Its nerve supply, again the median nerve, that is C6 and C7. Action is flexion of the hand at the wrist joint, and it also causes the radial deviation of the hand at the wrist joint, that is abduction or radial deviation of the hand at the wrist joint. The third muscle is the palmaris longus. Palmaris longus is the third superficial muscles of the anterior compartment of the forearm. Its origin is from the medial epicondyle of the humerus. This is the common flexor origin and is inserted into the flexor retinaculum and palmar aponeurosis. And its nerve supply is from the median nerve, that is C7, that is branches C7 and C8. Palmaris longus, again palmaris longus, its origin is from the medial epicondylae of the humerus and is inserted to the flexor retinaculum and the palmar aponeurosis. Its nerve supply is the median nerve, and action is it fluxes the wrist joint. Next muscle of the next superficial muscle is the flexor carpi ulnaris. It's having two origin, two heads, a humeral head and ulnar head. Humeral head is from the common flexor origin, that is the medial epicondylae of the humerus, and ulnar head from the medial aspect of the olecranon process of the ulna and the posterior border of the ulna. Then it is inserted to the pisiform bone, hook of the hamate and base of the fifth metacarpal bone. Its nerve supply is the nerve, ulnar nerve, that is C7, C8 and T1. So, for the function of the flexor carpi ulnaris is it flexes the hand at the wrist joint and it adducts the hand. The flexion and adduction of the is the function of the flexor carpi ulnaris, that is adduction and ulnar deviation of the wrist. Next superficial muscle is the flexor digitorum superficialis. Its origin is it's having two heads, a humero-ulnar head and the radial head. Humero-ulnar head is from the medial epicondylae of the humerus and the medial margin of the coronoid process of the ulna, and its radial head rising from the oblique line on the anterior surface of the shaft of the radius, and is inserted at the muscle belly, that is the flexor digitorum superficialis. The muscle belly give rise to four tendons distally, and each of the tendon attached to the slides of the middle phalanx of the four middle fingers, and its nerve supply is the median nerve. Action. Its action is it flexes the middle phalanx of the fingers, it flexes the proximal phalanx of the finger. It's a strong flexor of the middle phalanx of the fingers, and it's a weak proximal phalanx flexor, and it flexes the wrist also. That's flexor digitorum superficialis. So, the muscles we discussed were the superficial muscles of the forearm. They were pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris and flexor digitorum superficialis. Then there are three deep muscles also. These are flexor pollicis longus, flexor digitorum profundus and pronator quadratus. Flexor pollicis longus, its origin is from the middle of the anterior surface of the shaft of the radius and from the adjoining part of the interosseous membrane, and is inserted it is inserted at the distal phalanx, that is the tendon passes distally through the carpal tunnel and it attached to the distal phalanx of the thumb, and its nerve supply is the anterior interosseous branch of the median nerve. Its action is it flexes the phalanx of the thumb. So, that is flexor pollicis longus. Its action is it flexes the phalanx of the thumb. The next deep muscle of the anterior region is flexor digitorum profundus. Its origin is from the upper 3/4 of the anterior medial shaft of the ulna, and is inserted at the distal phalanx of the four fingers. That is, before inserting, the muscle divide into four tendons just prior as it passes through the carpal tunnel, and it attached to the distal phalanx of the four fingers. The nerve supply is also, there is a peculiar nerve supply, that is double nerve supply is the medial part is supplied by the ulnar nerve and the lateral portion is supplied by the anterior interosseous branch of the median nerve. Then action is it flexes the finger it is the exclusive flexor of the distal phalanx. It is a weak flexor of the wrist. So, the flexor digitorum, the function of flexor digitorum profundus is it flexes the finger, it is the exclusive flexor of the distal phalanx, and it is the one of the weak flexor of the wrist. Next muscle is the pronator quadratus. The next deep muscle is the pronator quadratus. It is seen at the lower quarter of the anterior surface of the shaft of the ulna and is inserted. It is inserted at the lower quarter of the anterior shaft of the radius. So, it is from the lower quarter of the anterior surface of the shaft of the ulna, it passes to the lower quarter of the anterior surface of the shaft of the radius. Its nerve supply is from the anterior interosseous branch of the median nerve. As is the name itself, we can understand that it is the muscle which pronate the forearm. So, we were discussing about the superficial muscles of the anterior compartment of the the deep muscles of the anterior compartment. The muscles include the flexor pollicis longus, flexor digitorum profundus and pronator quadratus. Now, forearm muscles can be divided. We divided the forearm muscle into two, that is anterior compartment and posterior compartment. Like anterior compartment, posterior compartment is also having the superficial muscle group and the deep muscle groups. The superficial muscles of the posterior compartment, the muscles are, the posterior muscles are the extensors muscle and extensor muscle, and almost all it's having a common origin, and it is from the there is a common extensor origin for all these muscles. So, the superficial muscles include extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris, extensor digitorum, extensor digiti minimi and brachioradialis. Then deep muscles of the posterior compartment include extensor pollicis longus, abductor pollicis longus, extensor pollicis brevis. Now, we will discuss the different superficial muscles of the posterior compartment. The first muscle is the extensor carpi radialis longus. It originates from the lower third of the lateral supracondylar ridge of the humerus and is inserted at the posterior surface of the base of the second metacarpal bone. And its nerve supply is the radial nerve, and action is extend and attack the hand at the wrist joint. So, extensor carpi radialis longus, it is from the lower third of the lateral supracondylar ridge of the humerus, and it is inserted at the posterior surface of the base of the second metacarpal bone, and nerve supply is from the radial nerve, and its action, it extend and abduct the hand at the wrist joint. Second muscle of the superficial extensor group is the extensor carpi radialis brevis. Its origin is from the common tendon attached to the lateral epicondylae of the humerus. It's having these muscles are having a common extensor origin, and the origin is from the lateral epicondylae of the humerus, and is inserted to the posterior surface of the base of the third metacarpal bone. And the nerve supply is the posterior interosseous nerve, and action is it extend and abduct the hand at the wrist joint. Next muscle is the extensor carpi ulnaris. This is the next superficial muscles of the posterior compartment. Its origin from the common tendon, again the common extensor origin, that is from the common tendon attached to the lateral epicondylae of the humerus, and is inserted at the posterior surface of the base of the fifth metacarpal bone, and its nerve supply is posterior interosseous nerve. Its action, the action of the extensor carpi ulnaris is it extend and adduct the hand at the wrist joint. Next muscle of the superficial muscle is the extensor digitorum. That is, it again originates from the common extensor origin, that is epicondylae of the humerus. Then once we discuss the regarding the insertion, the muscle divide into four tendons which pass to the fingers and form the dorsal expansion. On the dorsum of the hand, these are interconnected by the fibrous tissues. Near the proximal interphalangeal joint of each finger, the expansion divide into a central part which insert to the base of the middle phalanx and 2 lateral parts which insert to the base of the distal phalanx. So, insertion, the extensor digitorum muscle, the muscle divide into 4 tendons and it passes to the finger to form the dorsal expansion. On the dorsum of the hand, these are interconnected by fibrous tissues. Near the proximal interphalangeal joint of the each finger, the expansion divide into a central part which insert to the base of the middle phalanx and 2 lateral parts. So, the expansion divide into a central part and 2 lateral part. The central part inserted to the base of the middle phalanx and the 2 lateral part insert to the base of the distal phalanx. The nerve supply of this muscle extensor digitorum is posterior interosseous nerve. Action is mainly it extends the metacarpophalangeal joint. It also assists in extending the proximal and distal IP joint and arm. So, action of the extensor digitorum is extension of the metacarpophalangeal joint and it assists in extending the proximal and distal interphalangeal joint also. Next superficial muscle of the extensor compartment is the extensor digiti minimi. Its again origin is from the common tendon attached to the lateral epicondylae of the humerus and inserted via 2 tendons to the dorsal expansion of the little finger, and its nerve supply is from the posterior interosseous nerve, that is C7 and C8. And action of this extensor digiti minimi is it assists in the extension of the little finger. So, by the name itself we can understand that it is the extensor of the little finger. Next muscle of the posterior superficial muscles of the posterior compartment is the brachioradialis. Its origin is from the upper 2/3 of the lateral supracondylar ridge of the humerus and is come down and is attached to the base of the styloid process of the radius, and its nerve supply is from the radial nerve. Its action is it fluxes the forearm and it assists in rotating, its action is it fluxes the forearm and is assisting rotating or restoring the brachioradialis muscle. It origin from the upper 2/3 of the lateral supracondylar ridge of the humerus and is inserted to the base of the styloid process of the radius, and its nerve supply is the radial nerve, that is C5 and C6. Its main action is it fluxes the forearm, and although this muscle is along with the extensor group of muscle and the nerve supply is also from the extensor nerve, that is radial nerve, but it is the muscle which fluxes the forearm. It assists in rotating or restoring the arm into a mid-prone position depending upon the initial position. So, we were discussing about the superficial muscles of the posterior compartment of the that is superficial muscles of the posterior compartment of the forearm. It includes the extensor carpi ulnaris longus, extensor carpi radialis brevis, extensor carpi ulnaris, extensor digitorum, extensor digiti minimi and brachioradialis. All these muscles are having a common extensor origin, that is from the lateral epicondylae of the humerus. Now, there are certain muscles which is deep in the posterior compartment. The muscles include the extensor pollicis longus, abductor pollicis longus, extensor pollicis brevis. Abductor pollicis longus. The origin of the abductor pollicis longus is from the posterior surface of the ulna and is inserted on the posterior surface of the base of the distal phalanx of the thumb, and its nerve supply is from the posterior interosseous nerve, that is C7 and C8, and by the name itself we can understand its function, that is it is the extensor of the thumb. So, extensor pollicis longus from the posterior surface of the ulna and is inserted in the posterior surface of the base of the distal phalanx of the thumb. Nerve supply posterior interosseous nerve, and its action is it extends the thumb. Next muscle is the abductor pollicis longus. Abductor pollicis longus originates from the middle of the posterior surface of the shaft of the ulna and radius, and it is inserted on the posterior surface of the base of the first metacarpal bone. Nerve supply: posterior interosseous nerve C7 and C8. Action is abduction and extension of the thumb. So, abductor pollicis longus from the middle of the posterior surface of the shaft of the ulna and radius and inserted to the posterior surface of the base of the first metacarpal bone. Nerve supply is from the posterior interosseous nerve, and action is it abduct and extend the thumb. Next is the extensor pollicis brevis. It originates from the posterior surface of the radius and is inserted to the posterior surface of the proximal phalanx of the thumb. Its nerve supply is again the posterior interosseous nerve, and its action is it extend the thumb. So, we were discussing about the deep muscles of the posterior compartment. These muscles are extensor pollicis longus, abductor pollicis longus, and extensor pollicis brevis. Now, there are some intrinsic muscles of the hand. This include the thenar muscles and adductor pollicis, hypothenar muscles, lumbricals, dorsal interosseous, and palmar interosseous. So, the intrinsic muscles are the muscles which is seen inside which is not coming out of the wrist joint. These are the thenar muscles and adductor pollicis, hypothenar muscles, lumbricals, dorsal interosseous, and palmar interosseous. We will go through some of the important intrinsic muscles of the hand. The first muscle is the abductor pollicis brevis. Abductor pollicis brevis, its origin from the scaphoid and trapezium bone, and it's inserted at the proximal phalanx of the thumb. So, its action is adduction of the thumb. The next muscle is the opponent pollicis. Its origin is from the trapezium, and it's inserted to the metacarpal bone of the thumb, and its action is it rotates the first metacarpal medially, that is the function is opposition of the thumb. So, opponent pollicis brevis, opponent pollicis is the muscle which causes opposition of the thumb, and its origin is from the trapezium and is inserted to the metacarpal of the thumb. Next muscle is the flexor pollicis brevis. Its origin is from the trapezium and the first metacarpal, and it is inserted to the proximal phalanx of the thumb, and its action of the flexor pollicis brevis is it flexes and adducts the thumb. The next is intrinsic muscle of the hand is the adductor pollicis. It originates from the capitate, second and third metacarpal, and is inserted to the proximal phalanx of the thumb, and action is adduction of the thumb. So, intrinsic muscles of the other intrinsic muscles of the hand are hypothenar muscles, there are lumbricals there are palmar interosseous, and there are dorsal interosseous also. Next is abdominal muscles. So, the main function of the abdominal muscles are the functions are the movement and support of the trunk, and it assists in breathing processes, and the abdominal muscles protect the inner organ. Now, the abdominal muscles include the anterior abdominal wall consists of 4 pairs of flat sheet muscles. These are rectus abdominis, transverse abdominis, external oblique, and internal oblique. The first muscle is the rectus abdominal muscles. These are 2 parallel muscles seen on both sides, that is 2 parallel muscle, and it is separated by a middle band of connective tissue called linea alba. It originates from the pubis and is inserted to the xiphoid process and the costal cartilage of 5th to 7th costal cartilage. So, its action is the flexion of the vertebral column. So, for the muscles of the abdominal region include the rectus abdominis, transverse abdominis, external oblique and internal oblique. So, rectus abdominal muscle, and it is origin from the pubis and is inserted to the xiphoid process, and action is flexion of the vertebral column. The next muscle of the abdominal region is the external oblique. External oblique, it is from its origin from the external surface of the 5th to 12th rib, and is inserted to the anterior iliac crest and the abdominal aponeurosis of the linea alba. Now, external oblique is originate from the external surface of the 5th to 12th ribs and is inserted to the anterior iliac crest and abdominal aponeurosis to the linea alba. So, the function of the external oblique is flexion, rotation and lateral flexion of the vertebral column. The nerve supply is 8 to 12 intercostal nerve, iliogastric and ilioinguinal nerves. Next internal oblique muscle is the abdominal muscle is the internal oblique muscle. It originates from the anterior iliac crest and lateral half of the inguinal ligament and thoracolumbar fascia. So, it is having three origin. The first one is an anterior iliac crest, the second one is lateral half of the inguinal ligament, and the third origin is from the thoracolumbar fascia. It is inserted at the costal cartilage of the rib 8 to 12, aponeurosis to the linea alba. It is inserted to the costal cartilage of the ribs 8 to 12 ribs and the abdominal aponeurosis of the linea alba. The action of the muscle, the internal oblique, is flexion, rotation, lateral flexion of the vertebral column. Flexion, rotation and lateral flexion of the vertebral column is the function of the internal oblique. The nerve supply is 8 to 12 intercostal nerve, iliohyogastric and ilioinguinal nerves are the nerve supplies to the internal oblique. That is 8 to 12 intercostal nerves, iliohyogastric nerve and ilioinguinal nerves are the nerve which supplies to the intercostal muscle, internal oblique muscle. Now, there is another muscle is called transversus abdominis. Transverse abdominis is originate from the anterior iliac crest, lateral half of the inguinal ligament, thoracolumbar fascia and cartilage of the ribs 6 to 12, and is inserted at the abdominal aponeurosis of the linea alba, xiphoid process and symphysis pubis. So, it is inserted at the abdominal aponeurosis to the linea alba, xiphoid process and pubic symphysis. The action is it compresses the abdomen. Nerve supply is again intercostal nerve, that is 7 to 12 intercostal nerve, iliohyogastric nerve and ilioinguinal nerve. So, these are the muscles of the abdominal region. So, its main work is the function of these muscles were movement and support of the trunk. These muscles also assist in breathing process, and it protect the inner organ. There are some important inner organs are there in the abdominal region, and it protect all these internal organs. So, the muscles in the abdominal region are the rectus abdominis, transverse abdominis, external oblique and internal oblique. Now, the muscles of the back. Muscles of the back we already discussed on at the superior, that is in the thoracic and cervico upper thoracic region we already discussed. Now, the arrangement of the muscles of the back. The muscles of the back can be divided into three groups. A superficial group is an extrinsic group, we can say a superficial extrinsic group, and an intermediate extrinsic group and a deep intrinsic group or a deep intrinsic muscle. So, the back muscle can be divided into three layers: a superficial extrinsic group, an intermediate extrinsic group and a deep intrinsic group of muscles. Now, extrinsic group of muscles, the function of extrinsic group of muscles, superficial extrinsic group of the muscles, these are the muscles which connect the limb to the axial skeleton, and these muscles are innervated by ventral rami or cranial nerve level. Now, the muscles include the trapezius, latissimus dorsi, levator scapula, rhomboides major and rhomboides minor. So, the superficial muscle group include the superficial extrinsic muscle include the trapezius, latissimus dorsi, levator scapula, rhomboides major and rhomboides minor. So, these are the superficial muscle groups. Next is the intermediate extrinsic muscle group. Intermediate extrinsic muscle group include the serratus posterior group, that is, it includes the serratus, especially the serratus posterior group. It includes the serratus posterior superior and serratus posterior inferior. So, intermediate group is the serratus group. It contains two muscles, that is serratus posterior superior and serratus posterior inferior.